Good morning, everyone, and thank you for joining us today for a virtual roundtable on Trump's broken promises on healthcare. My name is BJ McAllister, and I'm the Deputy State Director for the Biden for President campaign in Maine. Joining us today for the roundtable is State Representative Drew Gateen of Westbrook, State Senator Linda Sanborn of Cumberland. Thank you both for being with us today. Donald Trump's presidency began with a lot of promises on healthcare, promises of better, cheaper health coverage that would cover anyone who wants it. Since he took office, he's broke every single one of those promises and has instead spent his presidency trying to sabotage President Obama and Vice President Biden's signature healthcare law, the Affordable Care Act. Donald Trump has told lie after lie to Mainers over the last 4 years about his healthcare plans and record. And with the first debate tonight, this may be the week he's finally held accountable. In a moment, we'll hear from State Senator Linda Sanborn on what Democrats in the Maine legislature have done to protect Mainers' healthcare in the absence of federal leadership. But first, I'd like to hand it over to my friend, Drew Gateen. Representative Gateen, can you talk to us about how exactly Trump's broken promises on healthcare have been a catastrophe for Mainers and Americans, and why we can't afford 4 more years of Trump and his disastrous leadership?
Hey, BJ, thank you very much. It's great to be here with you today and with my good friend, Linda Sanborn, and all the other folks who are joining this morning over the internet. And you're right. You know, we all remember Donald Trump's campaign in 2016 was all about big bombastic promises. And since he got elected, we know that all those promises have been broken. He either can't follow through or he never even really met him in the first place. And this is especially true when it comes to healthcare. When he was running for president, he made promise after promise after promise about Americans' healthcare. He said that Americans would end up with great healthcare for a fraction of the price, and that whoever wants healthcare is going to have it, and that nobody is going to be dying on the street if I'm president. But over the last 4 years, he's broken all those promises and failed to deliver. And I just want to talk about a couple things. The first thing I want to talk about today is the efforts of Donald Trump and Washington Republicans to sabotage the Affordable Care Act. Since taking office, President Trump and Washington Republicans have done everything they can to sabotage and repeal the ACA. First, they tried to repeal it through legislation. And Maine people remember the first big fight of the Trump administration was over Trump's attempt to repeal the ACA and replace it with a skinnier program that would have covered fewer people. There was tremendous public opposition to that bill, and we're all fortunate that it failed. But instead of giving up and abandoning this monumentally unpopular push to dismantle the ACA, Trump decided to go at it from a different angle. And in late 2017, the GOP passed their infamous tax giveaway. And one of the provisions in that terrible law is that it repealed the individual mandate in the ACA. And now Trump and his allies are using that to argue in court that the entire law is invalid and ought to be dismantled. And that lawsuit has been bouncing in the courts for a couple of years now, and is finally going to be heard by the Supreme Court the week after Election Day. And if Donald Trump and his allies like Mitch McConnell win that case, the entire ACA will be struck down. And let's be honest, let's talk about what that means. It will be devastating for Mainers, and it'll be devastating for people across America. In Maine, nearly 100,000 people would lose their healthcare coverage if the ACA was struck down. Across the country, that number is close to 20 million people. All the gains that we fought for over the years, including our tremendous win in 2017 when Mainers passed Medicaid expansion at the ballot box, would be lost. The ACA also guarantees that people with pre-existing conditions cannot face price discrimination from insurance companies. And if it was repealed, more than 130 million Americans with pre-existing conditions would lose those protections. People with diabetes, heart disease, people with behavioral health needs would lose their ability to maintain access to insurance and healthcare. And it'll make things worse and much more expensive, even for people who can maintain their insurance. Without the ACA, out-of-pocket costs for prescription drugs for Maine people would increase by roughly $2,000, and premiums would go up for many older Americans. So this is the danger we're facing if Trump keeps control of the White House and Mitch McConnell continues to control the Senate. Because despite all the damage that would be caused by dismantling the ACA, Trump's not only still pursuing it, but he's pursuing it with no plan to replace it. His administration has made it clear that they're willing to leave millions of Americans out in the cold. Now, these attempts to repeal the ACA alone have made his presidency a healthcare disaster, but we really can't talk about his failures without mentioning the catastrophe of his response to COVID-19. Trump's failures on the coronavirus pandemic are almost too many to count. He knew how deadly and easily contagious this virus was, but he deceived Americans by downplaying it and suggesting that it would just magically disappear. He refused to implement a comprehensive national testing strategy and actually encouraged his aides to have testing slowed down. And even after all these months and the deaths of 200,000 Americans and the devastating impact on our economy, he continually refuses to listen to the advice of experts, neglects to wear a mask himself or instruct others to do so, and fails to provide states with the adequate supplies and resources they need to deal with the virus. And the combination of these failures has had devastating consequences and has led to the world's worst COVID-19 outbreak, with more than 7 million cases here and 200,000 deaths nationwide, and cases are spiking again. And again, to make matters worse, all while this pandemic has raged, his administration has continued its efforts to repeal the ACA and kick millions off of their health care, potentially denying them life-saving care that they need during this public health crisis. It's a perfect storm of incompetence and bad policy and a total lack regard of what Americans need to live healthy and productive lives. You know, like a lot of you, I really am a healthcare voter. I grew up in a family where my father had a chronic disease. He was a small business owner, and he was the hardest working person I ever knew as a kid, but he needed healthcare to stay in the workforce as long as he could. And I've got a kid who has a chronic illness. And if the medicine she needs becomes unaffordable, or if she contracts the virus, her ability to be healthy and productive is definitely going to be at risk. So we cannot afford another 4 years of a White House that is controlled by Donald Trump and a Senate that's controlled by Mitch McConnell. I mean, the evidence is really clear. Donald Trump has created a healthcare crisis, but this November is our chance to hold him accountable and elect leaders like Joe Biden and Sarah Gideon, who will keep their promises to make healthcare more affordable and accessible for all Americans. So that's all I really wanted to share with you today, BJ, and other people listening. I'm really excited to hear what my friend Linda Sanborn has to say about some of the good things that we've actually been able to do in Maine now that Democrats control the House and the Senate and the Blaine House. Thank you.
Thank you, Representative Gattin. And you're absolutely right. The last 4 years have demonstrated that Republicans want to take away affordable health care, and Mitch McConnell and his allies will partner with Donald Trump to do just that. Meanwhile, here in Maine, Democrats in the legislature have done what they can to make sure that in spite of a vacuum of federal leadership, Mainers won't lose healthcare protections they desperately need. To tell us more about that work in the Maine legislature, I'm proud to welcome my friend, Senator Linda Sanborn.
Thank you, BJ. I am pleased to be with you today and to share some of the good work that we accomplished under great leadership in Augusta. First and foremost, Governor Janet Mills implemented Medicaid expansion after Maine voters overwhelmingly approved it years before. As the legislator who had the honor of submitting the first bill for Medicaid expansion, it was a long time coming, but Governor Mills listened and signed an executive order on her first day to implement the expansion, immediately making tens of thousands of Mainers eligible for MaineCare health insurance. Today, more than 60,000 Mainers have gained access to healthcare coverage. Low-income and disabled Mainers are finally able to access health insurance and get the healthcare they need. It is particularly important in the fight against Maine's opioid crisis, as people with substance use disorder gained the ability to better access treatment. We couldn't have known it at the time, but having expansion available for Mainers who have lost their jobs during COVID has been a blessing. Simply put, Medicaid expansion has saved lives. Maine has always been a leader on healthcare and was among the first states in the nation to enact key consumer protections that later became the basis for national healthcare reform. As such, Maine already had in place many protections prior to the ACA. The ACA strengthened, simplified, and closed loopholes left open in some of Maine's protections. Recognizing the importance of these protections, in the legislature, our first bill was to enshrine some of the patient protections of the Affordable Care Act here in Maine. LD1 made sure that nearly 600,000 Mainers with a pre-existing condition cannot be denied coverage. The bill allowed children to remain on their parents' health insurance policy until age 26. It requires that at a minimum, health plans must cover essential health benefits, essential health services such as hospitalizations, maternity and newborn care, mental health and substance use disorder services, prescription drugs, and more. The bill protects seniors and rural Mainers by codifying into state law the 3-to-1 limit on age and geographical rating established in the ACA. It restricts insurers from setting annual and lifetime limits to coverage. It requires no more than 20% of premiums being used by insurers for administrative costs, so that at least 80% of the premiums paid cover medical services for real people. Guaranteed issue is preserved across the entire healthcare market, across the entire health insurance market. Keeping these important protections in place is critical. Prior to the ACA, the US rate of uninsured was high and healthcare spending was rising rapidly. By 2016, after the ACA, the percentage of Americans with health insurance had reached an all-time high of 91%, and growth in national healthcare spending had slowed. We cannot afford to go backwards. Beyond expansion and LD1, Democrats passed and Governor Mills signed a suite of bills to make prescription drugs more affordable and accessible, all while holding Big Pharma accountable. Hardworking Mainers have long struggled to afford medication they need to survive, while Big Pharma makes obscene profits on the backs of everyday people. Democrats listened and did something about it. The state is now actively engaged in efforts to reduce prescription drug prices for Mainers, including pressuring drug middlemen to pass on cost savings to consumers and increasing transparency and accountability for drug manufacturers. And Maine will be able to import from Canada, where prescription drugs are often cheaper for the exact same medication, pending federal approval. Democrats passed several bills to address problems Mainers face with out-of-control drug pricing, but there's still much work to be done. This is one more reason why it is important to elect Joe Biden, who has a plan. BJ is going to share with you some of what those plans include. Thank you.
Thank you, Senator Sanborn. And I don't think there could have been a better contrast of what it means when Democrats are able to lead on healthcare versus when Republicans look to tear down healthcare. The work of Maine Democrats is incredible, and we're so grateful for what the legislature has accomplished to mitigate the effects of Trump's disastrous federal healthcare record. But in order to make sure that Mainers' access to affordable healthcare is truly secure, we need new leadership in the White House. Joe Biden has laid out a detailed set of plans that ensure every American could get coverage today. First, if you lost coverage with your job, Vice President Biden would have the federal government cover 100% of COBRA costs, so you can keep your same plan. Second, if you're uninsured, Joe would reopen enrollment for the Affordable Care Act now. If you're on Medicaid, he'd boost federal support until we've slashed unemployment. If you're not quite old enough for Medicare, Joe would lower the eligibility to 60 to give you another choice now. And no matter who you are, Joe Biden will make COVID testing, treatment, and any vaccine free. But COVID isn't the only health emergency Americans are facing. For millions of uninsured, the crisis has been ongoing. That's why Joe will protect and build on the Affordable Care Act. He was there when we passed it and helped secure the final key votes. It was a big deal, 100 years in the making. Now, he'll work to expand a new public option, the fastest path to universal coverage. lower premiums, deductibles, and drug costs, automatically enrolling eligible people in states that rejected Medicaid expansion, lowering Medicaid eligibility to 60 to give more people options, and doubling the funding for community health centers on the front line of healthcare in rural Maine. With so many lives hanging in the balance, we must do everything we can to make sure Joe Biden wins in November. If you'd like to join the fight to defeat Trump, go to maindems.org/volunteer. And if you haven't already made your plan to vote, visit voteinmaine.com for more information on how to register and all the different ways you can cast a ballot this election. That brings us to the end of our roundtable. I'd like to thank Representative Drew Gattine and Senator Linda Sanborn for joining us, as well as everyone who tuned in on our Facebook page. There are 35 days until Election Day. Enjoy the debate tonight, and then let's get to work.